While you don't have to be a doctor to understand the seriousness of cancer, everyone should pay close attention to the warning signs and the factors that can lead to diseases like breast cancer. So joining us to talk about the life-saving value of breast cancer awareness this month is Kimberly Lewis, the manager of oncology services at Piedmont-Macon Medical Center. Thank you so much for joining us in the studio this morning.
Thank you for having us.
Of course, go ahead and talk about, this month as a whole and why raising awareness is so powerful for people who might be battling the disease or have won that fight.
Yeah, well, October is National Breast Cancer Awareness Month, but it's really important all throughout the whole year. October just brings heightened awareness to breast cancer, but it's very important because 1 in 8 women in their lifetime will get breast cancer. So that statistics are quite high. So overall, nationally, there's over 375,000 women that will be diagnosed this year, and in Georgia alone, there'll be about 10,000. For males, we have almost 3,000 males that will be diagnosed nationally this year. So it's important for both men and women. It's very important to know your breast, learn your breast, report any symptoms, talk to your doctor, and it's just very important to get that message out to both women and all their family members.
Yeah, I don't think I've ever heard that statistic before, so it was very chilling to hear that number. I definitely know people that are close to me that have fought the disease or people that have had really close scares with it. So it really is important, and early detection especially is important. Talk a little bit more specifically about the early detection.
Yeah, early detection is really important because the earlier that we can diagnose breast cancer, the better we have at treating it successfully. So we want to be able to get our mammograms, on time. So starting at age 40 or earlier, if you have family history or personal history, talk with your physician, find out if even earlier is needed for you. But most women need to start at 40 years old and do that annually, do a breast mammogram annually. But also even starting at 20 years old, we really need women to know their breasts, learn their breasts, know breast self-awareness, doing breast self-checks, and seeing a physician every 1 to 3 years until the age of 40.
Yeah, are there anyone demographic-wise that is more at risk than anyone else?
Not necessarily. Women like Caucasian and African American women are generally diagnosed at about the same levels. However, African American women can die from the disease more often than Caucasian women. So it is really important to get those, to just have awareness in all communities, all races, because breast cancer does not discriminate. It is for all ages, races, even genders, things like that. But the older you get, the more the incidence increases. So we just want to make sure that we continue our mammograms.
Yeah, whenever we talk about any type of disease or illness, a lot of people question, the cause. Is there a cause that kind of leads to something like this?
So about 5 to 10% can be hereditary. However, most breast cancers are not. So therefore, there's modifiable risks and there's non-modifiable risks. So some of the things that we can change is knowing just healthier living. So keeping your weight at a good, obesity can increase. Alcohol and tobacco can increase your risks. Things like that are things we can change, that we have that control over. Would be better to have a healthier lifestyle in general. But there's things we can't change, like our age and our gender and our family history, our personal history, things like that. So you just really want to learn, your whole history, your personal history, family history, discuss it with your physician, and just know if you're at risk and know your breast well. So know and report any changes. So if you have any changes at all, report them to the physician. So changes such as anything in appearance, nipple inversion, any pain or tenderness, just change in the appearance at all, any discharge, things like that, you want to make sure that you report to your physician.
Yeah, I know obviously when we talk about this month or breast cancer as a whole, we typically do talk about women, but I know earlier you mentioned men, so do all those warning signs still align for men as well?
Yeah, same thing. So if a man has a lump in his breast, don't overlook it and just think, it can't be, because it can't be for men. So men have to take that seriously too. So like I said, it is much rarer for men to have it. About 2,800 is around the average for nationally. However, it does affect men, so especially those with a family history. So men also need to be aware of their breasts and report any changes to their physician.
Yeah, obviously in this month you guys will be holding some events over at Piedmont-Macon. Can you talk a little bit about one of the upcoming events?
Yeah, we're really excited. We have a lot of events planned for this month. One of them is our Tree of Hope. So that is to recognize any breast cancer current survivors, or in memory of or in honor of, where anyone in the community can come to Piedmont-Macon and fill out a ribbon. It's a pink ribbon that we hang in the tree, and that will be all month long, just to very much just recognize all the women that are either going through breast cancer or have fought the battle. So it's a beautiful little symbol outside of Building C. But we also have many events like our Saturday mammograms. So for those women that are working that can't get out during the week, we offer Saturday mammograms in October, November, and December. So we have multiple dates where that is available throughout those 3 months at both Piedmont-Macon Medical and also Piedmont-Macon North at both facilities. One of our big celebrations is going to be on October the 30th. That's our Stronger Together support group, where we're going to be having a breast cancer survivor celebration, and that's open to all of the community, any breast cancer survivor. And please just RSVP and come join us. It's going to be a good event. And we also have an oncology nutrition class on October the 23rd at 11 o'clock. And we welcome anybody to come to that class as well and learn more about oncology, cancer, and nutrition.
Yeah, well, thank you so much for coming in the studio and sharing all of this good information. I love doing these because I usually get to learn a lot, so I know that everyone else is learning a whole bunch too. Yeah. Just to recap for you, we're going to put up one of those events that she just mentioned on the screen. This is the Stronger Together Breast Cancer Survivor Celebration. It's happening Thursday, October the 30th. It's going to be at 11 in the morning. It's in the Cancer Center classroom over at Piedmont-Macon. If you'd like to go, you can call an RSVP at that number you're seeing on your screen, 478-765-4805. And of course, you want to make sure that you are scheduling your mammogram, especially if you're over the age of 40. As you just heard, there is a list of weekday or weekend appointments available. You can reach out to piedmontmammogram.org or call them at that number you're seeing on your screen, 1-877-357-0161. Make sure, of course, that you stay with us in our 8 o'clock hour when we continue our discussion talking about the importance of genetic testing for early cancer detection. Make sure you stay with us. Thanks for staying with us. Now, what if you had a way to identify the specific high-risk factors that could cause breast cancer? Well, we do. Researchers have identified a tool that makes early cancer detection possible. So continuing our conversation in the studio right now is Mrs. Kimberly Lewis, the manager of oncology services over at Piedmont-Macon Medical Center. Thanks so much for staying in the studio with us this morning. Talk to us a little bit about genetic testing for breast cancer and, why that is important.
Yeah, genetic testing is important for breast cancer because genetic hereditary does run in the family. About 5 to 10% of breast cancer that are diagnosed in women are related to a hereditary gene mutation. So it's not a high number, but it's a very important number that if your risk was because of hereditary, it can make you at higher risk for cancers or other cancers. So knowing that it's 5 to 10%, we want to test all individuals that meet criteria for testing. So genetic testing looks for inherited changes in certain genes, not just for breast cancer, but other cancers as well, that it will indicate that we have a higher risk of developing a cancer. So it's very important. It's a tool that we can use to really empower individuals. Knowing the results can help you with future screenings and prevention. It's a very good tool. It's an easy tool. So basically what happens is, you can talk to your family doctor, know your history, and then discuss if genetic testing is right for you.
Okay. Yeah, I know you just have been mentioning that typically these are people who have the gene through their family, I'm trying to say. It is hereditary, but do those people have to do genetic testing? Is that something that's required, or it's just something that's encouraged?
No, so what we do is anybody that has a diagnosis of breast cancer, we look at their personal and family history, and often that is looked at with a healthcare provider, or we definitely refer to a genetic counselor. At Piedmont, we have many genetic counselors that are available to talk and learn those risks. So what we do is we look at those risks and see if you meet criteria, because not all people that have or are diagnosed or have a history in their family of breast cancer need genetic testing. There is certain criteria for that testing. So some of that criteria is any woman that's diagnosed at an earlier age, like age 50 to 65 or younger. Those women definitely we want to look at for genetic testing to see why do they have this breast cancer. Is it related to hereditary, a gene mutation? So we want to look at that. We want to look at any male breast cancer because I was saying it is a rare, for a male to have it. So anybody, any male with breast cancer, we want to test them, we recommend. And anybody with certain types of breast cancer, such as triple negative breast cancer, or women that have breast cancer more than once, or have breast cancer along with other types of cancers. So there's many criteria, but it's best to speak with a genetic counselor and go over all of your risks. At Piedmont, we actually, every woman that comes in for a screening mammography, they're given a cancer risk assessment. So we know before they leave, we inform that patient if they have a high risk and should be testing and recommend testing. So they know before they even leave, and they're provided education, and our nurse navigators will help them set up an appointment with a genetic counselor. That is a free counseling that we offer at Piedmont.
All right, so at Piedmont, that would definitely be the best route in getting something like that kind of arranged for them.
Absolutely. And it's a simple test. What it is it's usually just a lab draw, so it's a blood sample or a saliva sample. Okay. And it usually takes approximately about 2 weeks, and those results come back.
And now, if a test comes back positive, does that mean that, there's automatically something wrong, or, what does that kind of mean for a patient?
No, so when we get the testing back, it's usually either a negative or a positive, or what we call a variant. So patients that do come back positive for gene mutation, different genes have higher risk than others and have risks for different cancers, even not just breast cancer. So we really want to recommend, you get that counseling with a genetic counselor and your doctor to know those risks, those individual risks. And we look at that because it doesn't mean just because you're positive that you will develop breast cancer or other cancers. It just means that you have a higher risk than average to develop those cancers. So therefore, with that knowledge, we can start earlier screenings or even prophylactic type things that we can do to prevent cancer from happening in the future.
Yeah, if there is one message that you'd like to share with our viewers when it comes to, early detection, what is that you'd kind of like to share?
Definitely just knowledge is power, and, education is key. So definitely get your mammograms, know your history, your personal history, family history, report it to physicians, and just get out there and get your screenings done and encourage your family members or loved ones and friends to do the same.
Alrighty, well, thank you so much for joining us in studio this morning. We've appreciated all the wealth of knowledge that you've come and shared. Of course, you want to make sure that you're scheduling your mammogram, as we've been talking about, especially if you're over the age of 40. There are both weekday and weekend appointments available to you. You can schedule those at that website on your screen, piedmontmammo.org. You can also call that number, 1-877-357-0161. The public is also invited to the Stronger Together Breast Cancer Survivor Support Group celebration. This is happening on Thursday, October 30th. Take a look at your screen, all the information there. It's at 11 in the morning in the Cancer Center room at Piedmont Macon. Of course, you can RSVP at that number, 478-765-4805.